have a quorum and it's the appointed time. I call to order the meeting of Panel on Health Services. Agenda item number 1, election of chairman and deputy chairman. Now we conduct this election for the chairman and deputy chairman of the Panel on Health Services for the 2024 session. The clerk has sent out notice to members that by the end of the deadline for nomination, only one valid nomination has been received. Ms. Rebecca Chen was being nominated by Dr. David Lam, and the nomination was seconded by Professor Cheng Wing Kwong. As Ms. Rebecca Chen is not the chair or deputy chair of any other panel or relevant government advisory bodies, in accordance with the rules of procedures and House rules, I declare Ms. Rebecca Chen the chair of Panel on Health Services. Thank you. Now we move on to the election of Deputy Chairman for Panel on Health Services for the 2024 session. The clerk has issued notice to members informing members that by the end of the deadline for nomination, only one valid nomination has been received. Dr. David Lam was being nominated by myself, and the nomination was seconded by Professor Cheng Wing Kwong. As Dr. David Lam is not the chairman or deputy chairman of any other panel or relevant government advisory bodies, in accordance with the rules of procedures and House rules, I declare Dr. David Lam deputy chairman of the Panel on Health Services for the 2024 session. Now we move on to agenda item number 2, schedule of meetings for the 2024 session, which has been tabled before members. You can take a look. There are 2 dates that we should pay attention to in March and October. In March, we have 2 sessions, and in October, we clash with a public holiday. So our meeting was rescheduled or is to be rescheduled in those 2 months. Any comment? If there's not, then we will hold meetings in accordance with the schedule. Agenda item number 3, items for discussion at the next meeting. The next meeting will be held on the 9th of February. The administration proposes 3 items for discussion. First, the interim report of the working group on the oral health and dental care. Second, e-health plus development. And 3, development of a joint user complex at Shenzhen areas 4 and 30 and update on District Health Center Express scheme. Members, do you have any views? If yes, please press the button. Yes? Professor Priscilla Lang, 3 minutes, please. Thank you, Chair. In the next meeting, let's see if the administration can talk about this, about the increase of public health service charges. I would like to talk about the abuse of A&E departments in hospital and the abuse of public health services by people who have emigrated elsewhere. I think that the administration should review this along with the raise in health service charges. Together with the deputy chairman, we will talk to the Health Bureau about the items of discussions in the 2024 session. When we meet with the Secretary for Health, we will discuss the proposed items for discussion mentioned by members today. Reverend Kuhn, please. Thank you. The government subsidized 90% of the healthcare charges. So I would like to discuss with the administration as to how we can solve these health service charges issue, perhaps we can have tiered charges. Thank you. Professor Chen Wing-Kong. Thank you, Chair. In the last legislative session, we made use of 25 minutes to discuss the development of Chinese medicine and the discussion of starting up this commissioner for Chinese medicine. I think that 45 minutes was not enough for us to have an in-depth development or discussion on the development of Chinese medicine. I hope that in this legislative session we can have enough time for us to discuss about the relevant development. Second, on the schedule of meetings for the 2024 session proposed by the administration, the Health Bureau would submit this policy. I hope that relevant stakeholders would be consulted about the details of the proposed legislative amendment. Thank you. Ms. Elizabeth Quat. Members of the public are concerned about the public health service charges, especially it will be increased for the A&E department in the future. On the introduction of drug, the administration said that an authority will be set up to monitor the drug situation in Hong Kong. I would like to know about the timetable. Chair, are also concerned women's health. There's been an increase in terms of the cases for cervical and breast cancers. I think that we should discuss that. With aging population, we have osteoporosis and it affects the lives of elderly. I've been asking for a policy on the skeletal health of people. We are importing more doctors to Hong Kong who are not locally trained, and the government has set aside money to train local doctors. I hope that the administration can invite the 2 medical schools in Hong Kong to talk about the training for local doctors. Also, I would like to talk about mental health of Hong Kong, and I've received complaints from members of the public saying that it's very difficult for young people to seek help from psychologists or psychiatrists. Thank you. Dr. David Lam, Deputy Chairman. Thank you, Chair. I would like to talk about health financing programs. For example, we should improve the voluntary health insurance scheme. We should perhaps set up personal and family health accounts, and also we should encourage personal accountability for healthcare services. Health Bureau and other departments are working on the healthcare services individually. I hope that we can have an integrated discussion, and also we should promote professionalization of the nursing industry. Ms. Lam So-Wai. Thank you, Chair. I mentioned this in the last legislative session in the panel on health services. I hope that we can discuss more on mental health. But I don't think that is as effective. The suicide rate for young people has been on the increase, and the carers committed suicide. These cases have not been dealt with. So I hope that we should accord priority to this issue of mental health. This item comes last on the schedule. I think that the Home Affairs and Youth Bureau and the Home and other departments, as well as the community care team, should attach importance to these. I think that we should have a system to handle high-risk cases. We should follow up on it. 18111 hotline cannot handle all these issues. Ms. Elizabeth Quat. Thank you, Chair. I would like to follow up. Professor Chen Wing Kong mentioned that we should have more time or set aside more time to discuss the development of Chinese medicine. I understand this issue is already on schedule, but we should further promote it, and there are issues that have not been dealt with. I hope that we can have a more detailed discussion as soon as possible. Is there any other members who would like to propose items for discussion for the 2024 session? If not, we will raise these points when we are meeting with the government officials. Last item, any other business? We don't have any. The meeting is adjourned. Thank you.